We're covering hip joint ligaments. We are getting into the last part of skeletal system, looking at how we connect bones together, which are articulations. When we cover ligaments, remember this is a type of connective tissue. As I pull up this chart that we've covered previously, we've looked at there's 4 types of tissue in the body: epithelial, connective, muscle, and nervous. And now we're talking about connective tissue. There's 3 types: connective tissue proper, fluid, and supporting. When we look at dense, regular connective tissue, that's what creates our tendons and ligaments. Remember, tendons connect muscle to bone. We're connecting bone to bone. So this is what we're covering today, is as we talk about ligaments, dense, regular connective tissue. Remember, it contains specialized cells that make fibers, and those fibers include collagen, elastic, and reticular. And their most abundant are collagen fibers because they give us that tensile strength. So as we look at hip joint ligaments, I'm showing you an anterior view on the left and a posterior view on the right. First, as we describe how we connect the ilium bone to the lumbar vertebrae, we call it iliofemoral. So like our previous videos, the words help to describe the joint where the 2 bones come together and how we connect them with the ligaments. So iliolumbar, we're connecting my ilium to my femur. On the anterior side, to connect my ilium to my sacrum, anterior sacroiliac. So anterior sacroiliac, which means on the posterior side, we have posterior sacroiliac, posterior sacroiliac, and anterior sacroiliac. As I get down to where we connect, first the sacrum to the ischial tuberosity, and then the sacrum to the ischial spine, we use those connections here. So these ligaments, and they cross each other. The one that's anterior and smaller is sacrospinous, again from the sacrum. And as I go posterior to the ischial spine, and when I look at Sacrotuberous, it's the bigger one on the posterior side, but I can still see it crossing on the anterior. It's going from the sacrum to the ischial tuberosity, So Sacrotuberous and Sacrospinous. As we dive into the actual hip joint where we connect the femur to the acetabulum and we're connecting to the coxal bone, then we can see first where I have connections to the pubis, to the femur, pubofemoral. So pubofemoral. As I come up towards the anterior side and going superior, there's actually 2 iliofemorals. There's a vertical and a horizontal. So if you see those separately, there's 2 iliofemorals, one that goes vertical and then one goes horizontal relative to each other, but it's connecting the ilium to the femur. So you can see iliofemoral and pubofemoral more on the anterior side. If I go the posterior side, connecting the ischium to the femur, ischiofemoral. So all we're doing is using the names of the landmarks and bones we learned previously and connect them with our dense, regular connective tissue to give me connections from the lumbar to the ilium, and as we describe the rest of the coxal bones connecting to the femur. These are our hip joint ligaments.